Well, it is the most common endocrine disorder of women. It's the most common cause of infertility, the most common cause of irregular menstrual cycles. So by definition, you have the label PCOS if you have two of the following three, and this is decided by a medical committee. You have irregular cycles of some sort. You have evidence of androgen excess. That would be like testosterone or the adrenal androgen, so that you would have like facial hair, you have to shave or do lasers. You're losing your scalp hair. What we call that, the similar for male pattern baldness only of women, we call that androgenic alopecia. Or you have like stubborn, hard to treat cystic acne, like in the jawline. So those would be, or you have blood tests that show that you have elevated testosterone or DHEAS. So that would be one of those two. And then the third is on ultrasound that you have evidence of polycystic ovaries, which would be tiny little cysts, many, many of them, over 20, that are lining the rim of the both ovaries. So you have either or all of the above, but at least two irregular cycles, evidence of androgen excess, and PCOS ovaries on ultrasound. Now, once you have that label, people are so excited. Now, at least I have a label. But it doesn't matter if you have the label, if nobody does anything, like you said, if no one does anything useful. The conventional approach is very similar to what it was many years ago. It really hasn't budged. It's give whatever, birth control pills, right? So you're going to say the ovaries aren't working right, which is true. They're not working right. They're not making adequate estrogen. They're making too much testosterone. In 80% or more of cases, that's what's going on. There are some variants of PCOS, which the minority ones, which we'll kind of leave off the table for right now. We'll go with the majority, which is too much testosterone, not enough estrogen coming from the ovaries. So you just go on birth control pills. It shuts down the ovaries and you replace them with the chemicals that are the hormonal mimics that are in birth control pills. And truth to tell, that will give the illusion in many cases of regular periods. Of course, the ovaries are not doing any of that. It's all artificial, smoke and mirrors, but it can lower testosterone, which can improve some of the other androgen excess symptoms that I mentioned, because when the ovaries are making testosterone, if you shut the ovaries down, they'll make obviously much less. And birth control pills increase the protein that binds testosterone called sex hormone binding globulin, so that you have a couple of mechanisms for having lower amounts of circulating testosterone. So those are good things. I cannot argue that, but you're not actually addressing the underlying causation. And here's the other problem. Birth control pills, well recognized by pretty much everyone, that they can increase blood clots. That's why, it's rare, but women can have serious blood clots and pulmonary emboli, blood clots in their legs when they're on birth control pills. So why is that? Is that an isolated thing? No, it's because birth control pills, not being human estrogen and not being human progesterone, are actually pro-inflammatory to a low degree, but they are. So they create inflammation. Human estrogen, when you have proper amounts, it regulates the immune response. So it's like it operates like the switch to turn on and off inflammation appropriately. Like you want to turn on inflammation if you have injury, like damage, like you have a laceration, you've been in an accident, or if you are invaded by a pathogen like a bacteria or virus. So we call it activation by the PAMPs and the DAMPs, the pathogens and the damage. And estrogen helps control the on switch, but we also need an off switch, because once the issue is addressed, you don't want to stay in a pro-inflammatory state. So you switch it off. And that's what estrogen does. And part of the inflammation response is aggregation and activation of platelets. Platelets are amazing. They are involved in blood clotting, so that if you have trauma, you don't have unrelenting hemorrhage and you'll die, right? If you have a big laceration. And also, that's how the body, it's the same mechanism that's involved in activating platelets that causes infections to be walled off, like you get an abscess cavity. That's how people have survived in the past, before surgery, before antibiotics, when they had a ruptured appendix. If their body could wall off the infection, isolate it in an encapsulated abscess cavity, and then over time actually resorb the infection and actually heal it. And that has happened. And other areas of the body, people can get an infection and get an abscess cavity and have it walled off. And so that is part of activation of platelets. And then platelets also promote healing. That's why people love to put platelets in their skin and their hair, like for rejuvenation, platelet-rich plasma. They stick it into joints and into backs and all over, because platelets also promote growth and healing. So platelets are amazing. But, when in their activated state as part of the inflammation response, they promote clotting. And that's what's happening when you use birth control pills. You're going into a pro-inflammatory state chronically. You actually lower your production of nitric oxide. You lower the control of T regulatory cells. Those are specialized lymphocytes that actually control your ability to determine self. It's part of your immune system. So women on long-term birth control pills with PCOS, because women with PCOS naturally have less production of nitric oxide and tend to be inherently somewhat inflamed. So you're like adding fuel to the fire, literally and figuratively, when you give women with PCOS birth control pills, and they're more likely to get certain autoimmune diseases like Hashimoto's, that's autoimmune thyroid. They get impaired gut barrier, leaky gut. They're more likely to have some, emotional problems and sleep apnea. So unfortunately, birth control pills being a pro-inflammatory inducer into women who are naturally now in something of a low level of inflammatory state activates that, and it can create more potential for issues involving inflammation long term, which we do not want, of course. And then the other thing that conventional medical world does, and they're not terrible. In fact, sometimes I use these things. They give metformin, which is an insulin sensitizer. But of course, whenever they've done studies in diabetics and pre-diabetics, exercise and lifestyle always beats metformin. So, and metformin is a nutrient depleter. It lowers B12, and it's an endocrine disruptor. And there's actually studies now in men who are on metformin for controlling their blood sugar. They are more likely to have babies with certain birth defects, not, because of being on metformin. It is actually an endocrine disruptor. So I'm not in love with metformin. I will use it sometimes, preferably short term. By the way, there was a study with berberine, which is an alkaloid extract that actually has some similar benefits in terms of insulin regulation and gut microbiome regulation. And there was a study comparing metformin and berberine for infertility treatment for IVF in women with PCOS, and berberine beat out metformin. So metformin doesn't help a lot with weight loss. It's like so-so. I mean, it's just so-so. And there are better things out there for the long haul. And then the other is a drug called spironolactone, which was originally a potassium-sparing diuretic, so like a water pill. And it can lower testosterone. It has a number of different mechanisms. But it can also cause birth defects if you have a baby boy, because it's blocking testosterone. So you have to be very careful about that. We don't want to create birth defects. So there's some negatives about spironolactone. So not everybody tolerates it. People can have side effects. So what do I prefer than the conventional drugs that I sometimes use, though, but I try not to, or not long term? Lifestyle. So all the things that we were talking about, and that's what I put into my book, is with what you eat, when you eat, certain fasting regimens that can be very helpful, working with sleep, with light, because women with PCOS, women who have hormonal imbalances have circadian rhythm problems. Like their own timing mechanisms are offline, they're not right, because estrogen, which is deficient in women with PCOS, which is not well recognized, that they are deficient in the estrogen that the ovaries make, called estradiol, which helps regulate the master clock in the brain that helps control the circadian rhythm, the timing of all the organs. So every organ is working in the same time zone, which is essential for optimal health. So we want to work with light therapy, sleep, fitness, avoidance of endocrine disruptors. Women with PCOS who have the worst cases tend to be the worst detoxifiers. So even if they're not exposed to more like plastics, like BPA that comes in hard plastics and can liners, they don't get rid of it as well. So their bio load, their toxic load is higher. and that interferes even more with their testosterone elimination, their processing of melatonin, their estrogen production. So it's like another bad thing that gets into them are these endocrine disruptors that they tend to hold on to more than the average woman, and that manifests in worst case clinical outcomes for these women. So, and then sometimes I prescribe estrogen and progesterone because sometimes we need to, it's like I think of them as training wheels. It's one of those catch-22s. If you don't have the right hormones in you, you can't heal. And then if you don't heal, you can't make the right hormones. So it's like you're stuck. So if I give human bioidentical hormones, not the birth control, phony, baloney, mimic hormones, but real human bioidentical hormones, not for a long time, maybe for 6 months, a year, that will help them to heal their gut, to heal their circadian rhythm, their sleep, their appetite will be better regulated, and they can get healthier, and then their ovaries will work better. And then I can take away the training wheels, and then they can go on their own. So I have to pull every trick out of the hat that I can to help my PCOS patients. And then I always work with stress management. We do a lot of biofeedback, meditation, guided meditations, all the different tools that are involved in lowering stress, because women with PCOS tend to have a dysregulated autonomic nervous system where they are in more of a stress state. And that's been shown that they have more what we call sympathetic output relative to the vagal output, the parasympathetic. So they're just in a more hyper state. And so we want to calm things down, and everything will work much better when we do that. So mind-body medicine is a very essential part of the therapeutic program for my patients with PCOS.